One of the most interesting cases that I have had to date was a 4-year-old boy who was at a barbecue eating when he suddenly grabbed his ear and started crying, complaining of ear pain. So they brought him to the emergency department, and he has a totally normal ear exam. Like, there's nothing. They said do some ibuprofen, see ENT in a couple days. So 2 days later, went and saw ENT. They did a full exam, and again, there's nothing. Totally normal exam. So family was doing ibuprofen and some numbing drops in the ear at home, and nothing was helping. So 2 more days later, came back to the emergency department, and they did a CAT scan of the mastoid, which is kind of like this area here, without contrast. Didn't see anything, looks totally normal. Told him to follow up with the pediatrician and ENT again in a couple days. So then another 2 or 3 days later, so now we're between day 7 and day 10, he comes back to the emergency department at 4:30 in the morning, and I'm the doctor on. Now he's having some fevers, and he's not wanting to eat and drink, and we have no idea what's going on with him. His ear exam was totally normal, and he was still complaining of ear pain. On the throat exam, he did have a little bit of swelling of the kind of tonsillar area on the right side, and a little bit of tenderness in the neck on the right side also. So we went all out. We did a CAT scan of the neck, which included the ears with contrast, and we did a ton of labs, gave him fluids, just did every test that we could think of doing.